I think one of the things that I love about working at Neighborcare is there's probably about like 20 languages spoken amongst the staff.
Porque ahí no nos preguntan si tenemos documentos o si hablamos inglés, porque cuentan con personal para traducir el idioma.
And it's more than just a cultural sensitivity, it's a cultural embracement.
Every time I walk through the door, it's like, "Hi, Mona," and they were so happy to see me and so happy to help me. And they will ask me about my family and how I'm doing and, like, how's life for me in America still till today. They make you welcome. They make you feel like, okay, I'm here. This is home. I don't have to be afraid.
We want to know what your story is. We want to know where you've come from. We want to know the challenges, whether it's been immigrating to this country, whether it's been moving from home to unhome back to a commitment to be homed, whether you're unemployed, seeking to be employed. We welcome those stories because we need to know your journey. Our promise is to deliver high quality health care, to make it accessible to those who need us, and to be there for them.
Especialmente el latino tenemos la idea de que enfermarse en Estados Unidos es una de las cosas más terribles que nos pueden pasar porque todo es muy caro y no siempre podemos pagarlo. Entonces tenemos miedo a enfermarnos realmente y tenemos el temor de acercarnos a una clínica, a un hospital, porque sabemos que el bill va a ser muy alto. Y sí conozco familias que muchas veces tratan de medicarse por su propia cuenta porque tienen ese temor de asistir a una clínica porque precisamente no conocen que existen este tipo de atención.
There is huge inequity in our healthcare system in which the poorest of people receive the worst care. And I don't think that's the way it should be, which is why I moved over to the Neighborcare system.
It's so easy to just look at the world like, don't nobody care. Nobody cares about them, but we care.
I was homeless and everything, and I didn't have any medical care. And my mother and my sister encouraged me to come to Neighborcare. Diabetes run in my family, and I was recently diagnosed in January of this year.
We then started insulin, which is not something you wanted to do.
No, I didn't.
Yeah, because your mom had diabetes.
Yes.
And that was not fun to watch.
Nope.
But you started it.
Yep.
And how are you doing now?
I'm doing great. My numbers are fantastic, and Maureen is just really great. She helps me to live healthier, and she taught me a lot of stuff about diabetes. I was very apprehensive about taking insulin, but she kind of encouraged me, and she didn't push it on me. She kind of educated me about it at first, and if I had a question, I could call her and ask her about it. And I want to be around to see my grandkids, and I have a college student daughter, and she's always worried about me because she went through the changes with my mother who passed away. So I want to be healthy for her and for myself.
I do like 10%, and Cynthia does 90%.
I do like 10%, and Maureen does like 90%.
Let's agree to disagree.
Okay.
Being able to be in a system that I'm really proud of, and then I can deliver great care to people who might never have had the opportunity to receive that care in the past, and knowing that all the people I work with are there to provide excellent care as well.
It's just so wonderful to be on a team where that's not one person's belief or perspective, it's shared by everyone, and so you just know that the work that we're doing is going to be meaningful because people are bringing the meaning with them when they come in.
About 6-7 years ago, I started getting sick, and I knew something was wrong, but I really didn't take care of it. I was living outside, drunk every day, 7 days a week. When you're outside homeless, nobody really wants to see you. Walked into Neighborcare, didn't have any money, so I didn't, they never asked for a dime from me. And without that health care, I wouldn't be here right now. Since I quit drinking, it's like I have a clearer head. I talk to my family now on a regular basis. We actually play video games together. We got to
Just went to see them.
just got to fly home, and see him again. I didn't think I'd ever see him again. That's what she gave me.
It's amazing to see somebody regain their life and their ability to live and be a part of their family, be a part of the community, have their hopes and goals back, have fun again, feel good when they wake up and want to wake up every day. It's like really special and humbling for me to be a part of that.
The people in Neighborcare, they're the best. They're there.
One of the unique parts about Neighborcare is our school-based health centers. We start at the elementary, middle school, and high school and provide an access point for those students who need health care.
I remember my freshman year, I just came in and, it's like the freshman experience, like big school, different people. And I was just really nervous all the time. And I had like mental health issues in the past, like leading up to freshman year and stuff. And I think for me, it was just I came in and I was like, yeah, I'm really gonna need help around here. I started to see Raina, the previous counselor. And from there on, I just started going into sessions and having group sessions. And like, it was just a safe place. Like sometimes I just walk in there and I'm like, does anybody have an opening right now? Like something just happened, like I just need to talk. They're all just such great people and they understand everything on like a social level and cultural level and just like what it's like to be a teenager and what it's like to be in high school. And it's really just nice to just have people who are open to share their lives the way you are.
I recommend it to everybody, even if it doesn't seem like you need it. Like I know that eventually everyone has their down times, and I know that someone being there can help with that.
It's a really dope place. I tell people about it all the time because I've been so many different places and I've never seen anything like this before, ever.
They send you the little reminder notice when it's time to get your teeth cleaned, or when it's time to come see Maureen, she'll give me a call, or my doctor will give me a call. It's like they really care, How many doctors do you know that'll call you and say, hey, where you been?
I'm very thankful for Neighborcare. Neighborcare has helped me a lot in a lot of different ways they don't even know.
They're not biased. They don't care your skin color. They don't care about your religion. They don't care how you look. They don't care what kind of sex you are. They don't care all of that. They're there to help you.
And we're going to start with where you're at, and we're going to help you figure out what's next for you, both in terms of your health and in terms of your health care. And we're going to be a part of your team helping you move forward in your journey.
Hello, welcome to Neighborcare.
Hi, welcome to Neighborcare Health.
Bienvenidos a Neighborcare Health. ¿Cómo estás hoy?
Salam, Neighborcare को सो
Namaste, आपका Neighborcare में स्वागत है.
Hello and welcome to Neighborcare Health.